Seborrheic dermatitis, in its simplest sense, or sebderm, is a chronic inflammatory skin disease, meaning that there's a variety of characteristic changes one might see on their skin. Red patches, greasy, flaky scales, and persistent itch, oftentimes in highly visible and cosmetically sensitive areas. The scalp, forehead, eyebrows, eyelids, cheeks, beard region, neck, and even the chest and back. And it's those symptoms being so visible that lead to this association with social stigma, negative self image, and even low self esteem. And the interesting thing is that despite being so common, it's estimated about 10 million individuals in the US at least have seborrheic dermatitis. Many don't recognize the symptoms, and therefore it can take years to get an actual diagnosis. So the reason why I'm excited to take a few moments to talk with you today and partner with Arcutis to raise awareness about seborrheic dermatitis and a new treatment option in the case of Zoryve foam. Oftentimes with patients, you have to prescribe multiple different products for different parts of the body with different instructions and different lengths of time. It's a mouthful just saying it, so imagine having to do it. It really can make care quite complicated. And hair-bearing areas as well are a major challenge with traditional agents like creams, gels, and ointments. And so a lot of folks have just not been satisfied with their treatment options to date. It's really exciting to say for the first time in 20 years, we have a first-in-class prescription topical foam. It's been approved by the FDA specifically for seborrheic dermatitis. This is Zoryve, or roflumilast topical foam, 0.3%. It's approved for adults and children 9 years of age and older. It's a once-daily steroid-free foam that reduces inflammation by targeting one specific pathway important to inflammation in this disease. It can be used anywhere on the body, all skin and hair types, and conveniently a water-based formula that's fragrance and irritant-free as well. And it's important to note in the clinical studies, the most common side effects seen included common cold, nausea, and headache. So the one thing I always tell my patients is make sure that, if something seems right for you, in this case, Zoryve foam, talk with your healthcare provider, have that discussion, especially in light of the signs and symptoms we talked about today. And for anyone that's interested, visiting zoryve.com, that's ZORYVE.com, is going to give you all the full prescribing information, important safety information, and important information about seborrheic dermatitis in general.